Huh. Yeah, come on in. What's up?
Hey, Dr. Padu, your patient's here in pre-op. Do you want to go see him?
No, can you just go consent him and I'll be right over?
What are you listening to, by the way?
It's not for students, man. Get out of here. And be thorough.
Okay.
What's up, everybody? DC checking in. Shout out Temple, shout out Podiatry. We just a couple students over here trying to spread the knowledge through a little bit of reps. Podiatry reps. You dig?
There once was a lady whose foot hurt something crazy, so off to Doc Ryerson she would go. It was 1923, and the reason for his glee was to treat another case of polio. So we got some joints, and I'm trying to score some points, so we coined the term Arthrodesis. But the common predilection was for taking larger sections, so the doc just said, that's decent. But it put him in a rut when he saw her short fat foot, cause he saw a high chance of non-union. With history out the way, we get back to present day, and the indications for our triple fusion. A collapsed valgus can be bad news for your talus, and a bunch of screws could be on their way. If you got an aggressive doc who can turn a foot to rock, cavovirus might just make him stay. A neurodeformity might be Charcot-Marie, and an arthrodesis might be in play. Maybe it's DJD or a clubfoot that I see that's just got me feeling this way. But all I really know, we need pain relief in droves, and the triple arthrodesis is bay.
Before we grab the scalpel, make sure we positive. This thing's a check, it's an eval pre-operative. First we check blood flow, DP and PT. 2 out of 4, we don't need no amputees. Next on our play, we do a muscle inventory. How about tendon balance? Transfer's mandatory. 4 foot on the rear foot on the leg. Relations to consider, not an angle misread. They got refaveris, and you go straight to fusion. Failure to correct the center, so you'll be losing. Time to get x-rays, let's see I go from Mary. CT, MRI, other views necessary. Call up Dr. P for a gait examination. Head to toe check as we look for compensation. All this info gathered and it triples in the future. Got patient consent, go on grab your suture.
Now on to surgery, close your eyes if you're weak. We gonna show you the 2-incision technique. Medial incision, medial mouth to the first med base. Don't forget your layers, Dr. Miles squirt you in the face. Don't forget a little lidocaine. Retract the skin along with the nerves and the veins. Round off the talar head and navicular base. Use a bird, don't be an amateur. Dr. Mann says preserve the periosteum. Preserve the soft tissue, come on man, it's obvious. Over drill, measure, put in the screw. We're halfway there, we gotta push through. Flip the foot over, another incision to be made. From the fib all the way to the 5th met base. Now we retract, vessels safely are enclosed. Capsular incision, now the joint is exposed. Saw a little here, saw a little there. Drill straight through, put screws everywhere. Suture it up, nice and tight. Say goodnight, turn off this OR light.
Going it. The post-op question, what do? Listen up for when the surgery's through. You can't bear weight, you break all the fixation and the beautiful alignment. Just because you're wildin', what I'ma do, I'ma cast you 8 to 10 weeks. Take some x-rays every 4 weeks to check on the feet. Then maybe we could get you to the street. Physical therapy is an option to help you get acquainted. Sometimes it's hard to get situated, but like all, there's some flaws. T-Buoy girl about to tell them what they are.
Some complications can occur with any procedure. Same applies to triple arthrodesis. Look for infection, always be critiquing. Warm and drainage, some ascending, streaking. Feverages and vomit, oh my God, is leaking. Odor so foul with unpleasant reeking. You can get avian necrosis of your bone. God forbid you can't get a fusion, that's a non-union. I can overcorrect, undercorrect, but I try to do my best to keep you in check. Don't be shocked when you can't absorb shock. That just come from the foot being locked. Many days pass by, we ain't done with the post-op devotions. and you're finally walking in sneakers and Crocs, feet protected with cushion and socks. It was time to say, doctor's high five, goodbye, but you notice your ankle lost range of motion. Painful feet from conversation with early propulsion. Many days passed by without batting an eye. The surrounding joints compensated, their cartilage degenerated. Bones rub together, irritate, stimulate, bony spurs activate, consolidate. Since you have this painful gaits you want to eliminate, so you locate a doctor and set up a date, and pray for the best for your fate, hoping your weight didn't affect your goddamn gaits.
This is our triple orthodesis presentation. Now you know a little about rear foot stabilization. Hope that it wasn't too complicated. Don't know if you need it. We listed indications. You got pain, foot ain't working normally, a little instability, or maybe a deformity. Was it a club foot? Was it a collapsed foot? Anywhere you put it, you were looking at a bad foot. But don't worry, you could get fixed up. We'll fuse you up, then we'll stitch you up. Hope you listened up and learn some stuff. Next time you hear of it, hope you think of us. Hope you think of us. Hope you think of us. Triple orthodesis, hope you think of us.